In this video, we will show you how to put a baby on CPAP.
And so I'm ready to attach the baby on CPAP.
Before you start, make sure the baby has an oral gastric tube inserted and has been suctioned.
So I need to put the hat on the baby.
The hat should fit quite tightly as it needs to hold the tubing and prongs in place. It should almost cover the ears.
Almost covering the ears. Instill normal saline in the nostrils.
Use a syringe to put a drop of saline into each nostril.
In each nostril.
Keeping a baby's nostril moist is really important. If you don't do that, it can cause necrosis of the septum. This means the baby may not be able to stay on CPAP and its chances of survival will be greatly reduced.
Before you put in the prongs, make sure that the settings are correct on the machine. Usually, when starting treatment, this will be 3 liters per minute of oxygen, with a total flow of 6 liters per minute. The bottle should have 6 centimeters of water.
These are just the usual starting settings. There are then algorithms for working out how to increase and decrease treatment. This will be explained in a later video.
And also make sure to check if it's bubbling by pinching the prongs and see if the water is bubbling.
Now you can put the prongs into the baby's nostrils. The writing should be visible, facing you. Otherwise, the prongs are the wrong way around. They should fit snugly and should not go all the way in.
I don't go beyond the markings on the prongs.
Make sure the prongs are not touching the baby's septum. As soon as you put the prongs, the water should start to bubble. Check, because if the water is not bubbling, it means something is wrong. Try to make sure that the tubing is not twisted and that it will lie naturally in the right place. This will tell you where to put in the hat clips.
Put the hat clips and make sure they are not in contact with the patient's skin.
Put the tubing into the clips. First on one side, then the other, and adjust it so that the prongs are sitting comfortably.
Make sure you readjust so that the prongs are attached properly on the patient.
Finally, the tube clip placed behind the baby's head will help to make sure the tubes stay in the correct place.
And there is a patient on CPAP, so I need to come and reassess the patient after 15 minutes of commencement on CPAP.
Depending on your findings for this and subsequent monitoring checks, you may need to increase the level of CPAP treatment. We will show you how to work out what level of treatment to give in later videos.